Hi, I'm Dr. Steve Newman, Executive Chairman and Chief Medical Officer of CentraForce Health. I spent my career managing patients as a physician and managing health systems. We're going to share with you today information that comes from that experience, which directly relates to challenges that you have each day. Provider CEOs tell us that the implementation of our solutions changes everything about the way they do business. For example, our service line expansion solution helps to identify where opportunities are to grow market share, how that's segmented by payer type, how to reach those particular patients, and finally, and very importantly, how to allocate capital within the provider system. So I know you as health system leaders struggle with limited capital to deploy and lots of strategic goals, one of which is growing the right service line in your fee-for-service environment. You probably have centers of excellence. You want to take market share. You don't know where it is. You can use our solutions to locate that demand, figure out whether or not you have an adequate physical plant or physician network to serve that new demand, and then allocate your capital accordingly. Let me tell you how this works. You know that your mandate is to grow market share because you're still in a fee-for-service environment, but you don't know where specifically that market share lies. We help you locate the market share you want to take by service line, by payer, and then we can tell you what resources you have in that particular geography or zip code from a physician or bricks and mortar perspective. This allows you to make much better strategic information on how to allocate capital, whether you need to recruit additional physicians or build a clinic or office space to meet that demand that you want to capture. Historically, many of you, like myself, made decisions of where to expand footprints in a market to capture market share. And we did this with limited information, specifically traffic patterns and things of that nature, where we would build a clinic close to a high traffic area. With CentraForce Health unique insights, we can geospatially locate for you where demand is, size that demand, overlay what network you have today, and help you make better strategic decisions in investing in expanding your physician network or capital decisions in building new clinics or office space. So if you're a large hospital or health system in an urban market, you have lots of competitors. And what you have to do is have an extremely attractive network, a network of physicians, a network of locations. But your challenge is that you have limited resources, both operating and capital dollars, to spend on expanding your network. What CentraForce Health's network adequacy solution helps you to monitor and measure the distribution of physician resources as well as brick and mortar facilities so that you are best positioned to both capture a new patient population you want to grow or to serve the patients that you've received through an attributed value-based care contract. So to complete the puzzle on expansion of service line or patient recruitment, there's one critical factor that's missing in many solutions, and that is how to customize the outreach to the patient you're trying to recruit and activate. CentraForce Health's proprietary engagement and communication channel preference scores does this for you. It does it by identifying that individual or population's trusted medium for healthcare information, their trusted messenger, and most importantly, receiving a message from a trusted messenger through the most trusted healthcare medium channel will result in the highest level of activation of that new patient that you're trying to reach. Without that activation, you're not able to close the loop on recruiting or expanding your service lines and especially your centers of excellence. With CentraForce Health's proprietary engagement and communication channel preference scores, we can give you information on your patient's unique affinity for certain messengers. For example, we have messages that come from physicians, messages that come from nurses, other ancillary healthcare providers, and interestingly, messages that come from pharmacists. And our clients are frequently amazed at the amount of trust that individual patients and members put in their pharmacist in terms of trust and willingness to take action as a result of a message from a pharmacist. So you, as a large provider, a hospital, or a health system in a market, have a never-ending challenge of trying to figure out how to improve the effectiveness and efficiency of your communication. So you can spend a lot of money on TV, and we know that's not targeted. So let's say you, as a hospital or health system, want to improve the success of your prostate cancer screening program. But you don't know how to do that because you're told that you should always use text messaging to males in your geography. The reality is, with the CentraForce Health unique engagement communication channel preference scores, you know how to focus your outreach based on payer type and geography. So within your market, from zip code to zip code, you may find differences in what is the most effective way to activate male patients to come to your prostate cancer screening program. You can only do this with the proprietary engagement communication channel preference scores from CentraForce Health. Thanks for watching our video today, and I hope you found it interesting and intriguing. Please use the embedded information below to contact us so we can continue this conversation about the challenges you have in your organization today.